99% of the people that are in here have been treated at Barrow at least. And if you haven't had surgery by Dr. Spetzler, you know who he is, because he's world renowned for what he does and the best of the best. I tell people all the time, my father-in-law's a neurosurgeon, has been a neurosurgeon for how many years, son?
A million, it feels like.
Yeah,
I think.
pretty much a million. And he thinks Dr. Spetzler is God. So if that tells you anything, then you know, I'm just honored, and I know everybody else is, to have you here, and I really appreciate you taking the time to do this. So thank you very, very, very much.
I don't know, Natalie, after that introduction, I think I better leave. Sort of wish my parents would have been here, my father would have smiled, and my mother would have believed you. I thought what I would do is just sort of give you an overview of aneurysms and maybe how to manage some very, very difficult ones where routine ways of treating an aneurysm are not possible. And so to really sort of define what an aneurysm is, these little videos help. But maybe I'll borrow that stupid line, and that way you can see the screen better. And so what you're really seeing here is aneurysms occur in any of the blood vessels in the brain. There are more common sites and less common sites, and when you're looking at these little balloons, that's what an aneurysm is. And this is basically how they form. You've got this constant blood pressure, this pulsation from the heart. It keeps you alive because it brings out nutrients, it brings oxygen, it takes away the CO2. And so when you exceed that tensile strength of the dome of the aneurysm, that's when it breaks. And when it breaks, unfortunately, that is a absolutely devastating event. More than half the patients, obviously nobody here, dies from when this aneurysm breaks. And of those that survive, actively, less than half are normal. So it's just a very, very devastating event. And what you're really doing is seeing a brain over here of an unfortunate patient that had a hemorrhage from an aneurysm, and what you're seeing is all the blood at the base of the brain. And because your brain is inside a closed space, when it bleeds, that pressure just builds up. And when that pressure exceeds the pressure of your blood pressure, then the flow in the brain ceases. And when there's no blood flow, it literally takes a few seconds before you have irreversible brain death followed by death. But there are treatments, and especially for those, I just finished clipping my second aneurysm for the day. And in this young woman, she bled yesterday, and she's going to do very, very well because she had a minor bleed. It's localized. Even though she'll be critical for the next couple of weeks, she has an excellent chance of doing well. So you have these two techniques. One is which puts coils into the blood vessel, into the aneurysm, and the other one is clipping it. They both have their advantages and disadvantages, and they're both excellent treatments. So what does a normal person have when they have a bleed like this? What you're looking at is this is a CAT scan, and all of this white stuff is blood. So there's a huge explosion. This is a young man. He had a severe headache, and within a few minutes he became comatose. He was rushed in, and it was sort of a desperate midnight operation because with all this blood inside the head, you can imagine the pressure inside the head was enormous. So time was of essence. And this is really what you're looking at. This is through the surgical microscope. You see everything is red, and that's all blood where spinal fluid should be, surrounding, layering in the brain, and that's the blood vessel. And I don't want to show you too much so that none of you are going to start doing this on your own. And we put a bunch of clips on. So I'm going to go quick just so you don't catch all my secrets. And then with multiple clips, and you notice there's nothing in there to hold the brain apart. Not that many years ago, we always put in retractors, and now we don't at all anymore. which makes a very big difference because the brain doesn't like to be moved around. And then in this particular patient, we then take out that big blood clot that you saw, and fortunately, by the next morning, he was following commands. So this is what he had beforehand, and that's with the clot removed. Now he went through literal hell in the intensive care unit for about 3.5 weeks, and eventually made an excellent recovery. So that, he was just on the other side of that not making it at all, in that 50%.
Dr. Spetzler, what do you
Yep.
mean by literal hell? I mean, what post happened?
Because he'd be worse one day, better the next day, and there's something called spasm of the blood vessels, which many of you will remember, and that's because the blood is a big irritant to the blood vessels, and the blood vessels shrink down. And when they shrink down, it's very hard to get blood through the blood vessels, and it can be so bad that you don't get enough blood through, resulting in stroke. And when that happens, it's obviously an additional insult to the brain and will often lead to permanent neurologic deficit or death.
Is that the basal spasms?
That's exactly right, vasospasm. Yeah. So, there are some aneurysms that you can't clip or coil, and so I'll just spend a little bit of time on that because we have the world's largest experience, which is called hypothermic cardiac arrest. And I'll just sort of explain that a little bit to you. When you think about cold, there's a great story from Japan where Alok Ya spent 24 days at a very, very low temperature in the mountains and survived. And basically what he did is, there's a mammalian reflex which allows you to hibernate. And I'll explain that a little bit more. Any one of us, if we were normal temperature and we were without food or water for 24 days, we'd obviously be dead. Nobody survives that. You can survive without water 3-4 days, without food longer than that, but it's really over. Well, we use that all the time, right? And here's a very dramatic example. We have some. I'm sure it's turned on. Is it on the right? Just make sure it's on. Sort of nicer if you can hear it. If not, I'll have to make the sounds for you. Any other I'm sure it's not. Let's try it one more time. See if it works. I just don't hear any sound. I guess not. Well, anyway, there we go.
Yeah, it works. It's gonna, the buzz probably works.
Anyway, this little boy was underwater in the ice in Lake Michigan for 45 minutes. He was brought up, there was no detectable pulse, no detectable blood pressure, and he was resuscitated. And as I mentioned before, if you're without water, without oxygen for seconds, not breathing, but no oxygen to the brain for seconds, you have irreversible brain damage. What he had was that same mammalian reflex. Because he was a child, he cools very, very quickly, And what happens is, just like when you're in a refrigerator, things keep longer, is when you become very, very cold, your engine, your metabolic engine is turned way, way down. So it doesn't require that oxygen, it doesn't require that glucose and nutrients. So you basically are in a suspended state. And this little boy made a complete survival, and here he is a few years later. And we obviously use this all the time in the refrigerator and icebox. And mammals do it. And this is a little chipmunk. If you just notice his body temperature is 100 degrees Fahrenheit, his heart rate is 350 beats per minute. He gets ready for winter. He goes into his little den, and what happens? Well, his heartbeat goes from 350 to 4. Just think about it. So he's basically just shut down just the bare maintenance of his body to keep it alive with a little bit of a heartbeat and a little bit of breathing. And that makes so much sense that we want to use that clinically, and that's where hypothermic cardiac arrest comes in. You basically take the brain and you turn it down as much as at all possible. And this is, oh, we can't hear that, can you?
I'll try this one. Be a little louder.
Death. 28-year-old Anna Wagenholm plunged through a hole in the ice. Anna was stuck in the gap between the river and the ice. Her head was half submerged in water, but she still managed to breathe. Anna's boyfriend was desperately clinging onto her skis to stop her being swept away. He could feel Anna wriggling, trying to free herself below. Anna grew weaker and weaker. After half an hour, she stopped moving altogether. Hypothermia had stopped Anna's heart, but it may also have protected her brain.
And suddenly we could see the first heartbeats. And that was, of course, a very, very strong moment. Extremely strong moment.
1999 was the day that one unfortunate skier came face to face with death. 28-year-old Anna Wagenholm plunged through a hole in the ice. Anna was stuck in the gap between the river and the ice. During months, her head was half submerged in water. She learned she still managed to breathe. Anna's boyfriend was desperately clinging onto her skis to stop her being swept away.
I'm not sure what happened with it. At any rate, despite the fact that she should have been dead, she had that same sort of reflex, was protected by the cold, and ended up making a complete recovery and return to her function as a physician. So we use this for aneurysms that we can't clip or coil. And why can't we clip them or coil them? Is because they're giant. Because we can't get control of the blood vessels that feed, sort of like a bomb, if you can't get down to diffuse it. So what we do is we put the patient on a cardiac pump. Then you have the circulation going through the pump and through a refrigeration unit, and the temperature goes lower and lower. And at some point, the temperature's low enough so the heart stops all on its own. And that allows us then to take these complex aneurysms and fix them. We only use that in extreme measures. I've personally operated on more aneurysms than anyone else by a long shot. And I've almost 6,000 aneurysms. I've used this technique 106 times. And patients come from all around the world when they have such complex aneurysms that they can't be treated any other way. So you can see that it's really very, very rare that this is indicated. Natalie?
At what temperature does the heart stop? Is that different depending on the person?
It varies a little bit from person to person, but your normal body temperature is 37.5 centigrade. And as your temperature drops down to 33, your heart begins not to like it. When it gets down to 29, it'll be very erratic. And by 26 degrees, it almost always stops. We go down to 15 degrees centigrade, so that's very, very low. And I'll show you how that's done. So when you have a really terrible aneurysm that you can't treat any other way, this is what we use. This is actually one of our patients.
Discovery Channel with her? Were you on the Discovery Channel
Finally got to the point where I couldn't stand it anymore.
28-year-old Brett Kehrer was given a terrifying prognosis. The aneurysm, a massive swelling of a blood vessel in his brain, could kill him at any moment.
And what happens, it bulges out from the pressure inside the tire, and as it bulges out, it actually gets weaker and weaker the thinner it gets, until the pressure exceeds the tolerance and it breaks. When that happens, it's pure disaster. Back to the incredibly protective effect of cooling. We need less and less nutrition, we need less and less blood flow, until finally to the point where you can get along without any blood flow for up to an hour.
Brett Kehrer's heart has stopped. There are no signs of life showing on any of the monitors.
Now we really get our first view of the aneurysm. This structure right below it.
With the aneurysm gone, Spetzler now attempts to bring Brett back to life.
Every day,
The problem is not
blood in my ears,
stopping.
down around my jaw. Finally got to the point where I couldn't stand it anymore.
28-year-old Brett.
And at any rate, the neat thing right here is afterwards you ask him to do a command and he's lifting up his two fingers. A few months later, he gets married. And
How big was his aneurysm?
what?
How big was it?
It was about 4 centimeters, which is almost 2 inches. Huge. The normal size aneurysm, the average size aneurysm that bleeds is 6 millimeters. So they're huge. But it's not just how big it is; it's also the location, how difficult it is to get to. So, yes.
If they thought he died, how do you know he didn't die?
Well, he didn't really die. He was in a state where if we used all the criteria for death, he would be dead. He didn't have a blood pressure, he didn't have a heartbeat, he had no respiration. But he was also very cold. And because when you're very cold, it means that your body doesn't disintegrate. So that even though by clinical criteria you're dead, you're not dead because you're also cold. And then you reverse the process. And what happens is that instead of cooling with that pump, what happens during surgery is you actually shut off the pump, the blood is drained from the body so that that balloon can collapse. Then you turn on the pump, and now instead of cooling, you warm and you gradually bring the temperature back to normal, and you hope that the heart restarts, etc.
Well, it's new phone.
It's
I
not
know.
yours. It's
I'm
not.
sorry. I know how to turn it off.
It's not yours, Robin.
It is.
I have yours with me.
Oh, you got it. It's not
It's
me.
A question, Dr. Spetzler, in regards to the elasticity of the aneurysm.
It's yours, Brett.
For it to
Sorry.
It's okay. When you're dealing with aneurysms, that ringing phone just is not a big deal. Go ahead.
If you have high blood pressure, does that warrant it bursting sooner?
Yes. Unfortunately, there are some risk factors that are
That would cause it to
very
rupture?
treatable. High blood pressure increases the risk of it rupturing. That makes complete sense. You think about a little balloon, pressure goes up, it's easy to rupture. One of the most important is not to smoke. Smoking increases the growth of the aneurysm and increases the risk of rupture. So I trust none of you are smokers anymore. Gabriel?
How much does family history play in this?
A very big role. If you have a family history, your risk of forming a new aneurysm and aneurysms that are more likely to rupture is much, much higher. So when you have a family history, then I recommend starting with an MRI scan. It depends a little bit on the family history because there are a few exceptions where aneurysms occur in the very young, and I'll show you one such case. In which case you want to start an MRI scan based on whatever the youngest person in the family history was that bled, and subtract 10 years. So if you're a 5-year-old, you obviously can't subtract 10 years. but you start getting scans every so often, depending on how high you consider the risk. Yes.
Yes, when I had my aneurysm, Dr. McDougall clipped it once, and then I came back and it had grown more, and he clipped it, or not clipped it, but coiled it again, and they thought it was okay. And then 9 months later, I was leaning over the dishwasher and passed out, and my daughter found me 31 hours later. They took me to the hospital, and then they brought me to Barrow's again. And I saw Dr. Nakaji, and he took a vein out of my arm and put it up into my head. Can you talk a little bit about that?
Yeah. One of the problems with coiling is it's not as definitive as clipping. It's because when you saw in that little video, the clip closes off the neck. The coils fill up the sac, so there is a higher risk of recurrence with coiling than there is with clipping. But there's also a lower risk of treatment. So Dr. McDougall is very, very good. And Dr. Nakaji is very good because I trained him, so.
What do they call that when they take the vein out of the arm? And
that's a radial artery graft. That's basically rerouting around a blood vessel so that you go proximal to the aneurysm and distal to the aneurysm, and you sort of have a blood that still goes to the brain by going around the aneurysm. I'll even show you one of those. Go, yes?
Can you talk a little bit about pipeline stents? I'm going to be having one.
About what kind of stent?
A pipeline stent.
And it's Dr. McDougall or Albuquerque?
No, it's in Canada. It's Dr. Mitha who trained under you.
Oh yeah, yeah. And he was just here. He ran the marathon. I don't like him very much because he did much better than I did. So.
You don't like him?
But as a doctor and as a human being, you couldn't have a better person.
Can you talk about it?
Not his competition on the track.
The pipeline is a newly approved stent. It's still, the history of its success is still being evaluated, but it's a very elegant way of redirecting blood flow away from the aneurysm and towards its normal course. And for the right aneurysm, it can be very effective.
Have you done that?
I don't do them, but Dr. McDougall and in fact, as Dr. Albuquerque has the largest experience in the United States here. I mean, in the United States,
So
that's right here.
Lots.
Yes, yeah.
Thank you.
And you're in very good hands with that.
Dr. Spetzler,
Yeah.
Robin had, Dr. McDougall did the coiling of her aneurysm a little over 4 years ago. 3 big bleeds she had. We come back every 2 years. I mean, is that all we can do? How do we,
Yeah. Yeah, as
I
long
worry
as
all the time. She doesn't worry about nothing,
Well, if one of you worries, that's probably more than enough. Worrying itself doesn't do any good. As long, it has to be checked, and as long as the aneurysm is fully occluded, that's what you're shooting for. Yes?
You know that we're going to have 50,000 questions. Why, because I've been reading up on this pipeline procedure, and why would they choose to do that as opposed to a clip or a coil? What would be that reason?
It depends on where the aneurysm is. So if there aren't a lot of side branches, the pipeline is a stent that has more metal on it, so it's denser. So it's less porous, which means that if blood goes through it, it's less likely to go out through the pores than it is with a regular stent. So it helps redirect the blood away from the aneurysm, and in many cases that aneurysm will just clot off. If there are a lot of branches that are coming off right next to it, then there's a risk of it shutting off those branches as well. And a stent just does not eliminate the risk of bleeding, but it reduces it significantly. A clip does not completely eliminate the risk of bleeding, but almost. but almost completely. There's always a weakness in the vessel wall, so you can regrow. That's why we keep checking them over and over again. Every 3 years, every 5 years, every 10 years, depending on what it looks like. Let me finish this real quick, and then I'll answer some more questions. This is a young 5-year-old, and you can imagine as a parent suddenly hearing your 5-year-old scream in the bedroom, and you know immediately from the sound that it's not a scream wanting attention or not getting what he wants, but a terror scream. And when they came in, almost as a relief for the parents, he became comatose. They brought him in, and you see this very large aneurysm. He was one other one, and here, this is what an aneurysm looks like. This is a normal blood vessel, and this is that big bulb that had ruptured in him. And we operated on him on a weekend, and he's the youngest patient that ever underwent this hypothermic cardiac arrest. He's 5 years old. And it was a tough case, and he made the news, and I particularly love the ending, and I'm hoping that this one will work properly. I don't want to belabor the point here with this. But a very difficult ICU stay, but ended up making...
Tonight, a story about a medical miracle that saved a Mesa kindergartner's life. 5-year-old Chase Meserol had a brain aneurysm when a blood vessel ruptured. A doctor saved his life by performing a rare procedure that literally put him to death. Kathleen Mascarenhas is outside Barrow's Institute with his amazing story. Kathleen?
Sue Chase is the youngest patient in the world to have had this procedure done, and it was done here at the Barrows Institute. Now, the procedure or the technique is called the hypothermic cardiac standstill. Basically, a doctor puts his patient into a state where he or she is medically dead. In order to live, 5-year-old Chase Meserol had to die first.
See how everything is completely flat?
It's a state doctors are trained to prevent. In this case, death was Chase Meserol's best shot at life.
You only use that when you have no other alternative.
Robinson! It's hard to believe for 10 minutes, Chase had no heartbeat, no pulse, no blood pressure.
For me, it wasn't a choice. You know, absolutely, go ahead, we'll try it. Because he was sleeping. I mean, he wasn't responsive, and it wasn't like he was alive.
At the beginning of the procedure, Chase's body was brought down to 80 degrees. At that temperature, his heart stopped. He was then hooked up to a heart and lung.
They told you they were going to stop his heart.
His doctor says Chase should live a completely normal life.
Yeah, I saw him maybe 10 days ago. Now he's a charmer.
Oh, the ball goes in the air. Die for it. We're kind of like the...
Now, Chase is back in kindergarten. His mom and dad say since the surgery, he's probably a much sweeter, more polite 5-year-old, but they also say it is starting to wear off just a little bit. Reporting live from Phoenix, I'm Kathleen Mascarenhas.
Oh, he's a cutie.
Absolutely.
My point is, I don't think you really want an aneurysm with hypothermic arrest just to make your kid sweeter. I'll show you one more case, and this is a 14-year-old. That's the world's largest aneurysm that's ever been recorded or seen. And all of this is an aneurysm. All of this.
And how large is that?
It's, if you look at your skull, it's taken up about a quarter of the insides of your skull. So the longest dimension is about like this. So he's one where you can't clip alone because you've got to supply blood. There's a lot of thrombus in it, and it does what you were talking about with the radial artery, with that artery, is we took 2 arteries on the outside of the skull and hooked them up past the aneurysm so that it would feed the brain, and then shut off the aneurysm. And this is what you're seeing. So this here, there's a big blood vessel missing, and that is now being fed from, this is now being fed from these vessels outside, and the aneurysm is no longer filling, so it can't cause any more trouble. And over 13 years, you can see it was this big, and now it's this big, and doesn't cause him any trouble whatsoever. He got married, and that's very unusual to have such a long follow-up for that. So this is a little 18-month-old Very unique case. I'm not going to show you that video. I'll show you what we did. This is sort of conceptually, this is the first time that's been done, and that's what basically saved her life. We took a vessel from the other side, and we plugged up that hole, and these are with sutures much thinner than a human hair under big magnification, and it really allowed that aneurysm to be gotten rid altogether. And it's really cute because when this blood clot was seen at another hospital initially, they thought that this must be from child abuse. So these distraught parents who were so worried about their little baby, by law you have to report that when you suspect that, and once those wheels start, they are very, very hard to stop. So when he was transferred over here, despite the fact that we reassured the state that this is clearly not child abuse, it took a long time before that extra burden was lifted from the parents. Bottom line, so, is she did remarkably well, and so I've sort of showed you the degrees of complexity with which some of the aneurysms require treatment. Most of the time, aneurysms are small; they can be clipped or coiled. But every once in a while you have to do some of these things that I've shown you. And there are improvements all the time, but really the best way to avoid a rupture is to find the aneurysm before it ruptures. So the only thing you can really do is take the high-risk patients and examine them, usually with an MRI scan, and if you find an aneurysm that is at risk, to fix it before it ruptures. The risk of an aneurysm that hasn't ruptured from treatment, the likelihood of everything going well is significantly better than 95%, but it's not 100%. Anytime you go under anesthesia, anytime you open the skull, there are all the risks: death, coma, paralysis, infection, anything you can think of. That's what I always tell them. But when you consider that if you bleed, you have a better than 50% chance of dying, and if you survive, a better than 50% chance of not doing well, it's not a hard decision to make. I'm happy to answer any questions. Yes, Rob?
Well, that was, you said that MRA, didn't MRA?
MRA is magnetic resonance angiogram.
Yeah.
MRI is just magnetic resonance imaging. They both can show an aneurysm. If you're not looking for an aneurysm, then it's usually you're getting an MRI. An MRA is the same tool, but it has sequences which show the blood vessels much better.
So my family get an MRA.
Correct.
Sure.
Correct.
Okay.
Yes.
My mom had surgery with you 3 months ago. Should she have follow-up MRAs in the future to make sure that she doesn't get
in 3 years.
3 years. And
I'm sure that's down in her chart, and she'll automatically be notified.
Okay. And I'm a hypochondriac, and so now that it's happened to her, it'll definitely happen to me. Should I also have an MRI?
Is there anybody else in the family that's had an aneurysm?
No.
No. So, most of the time, to reassure you, the vast majority of time, aneurysms are what are called sporadic. That means that they occur sporadically in the population, and your chance of having a familial aneurysm is very small. Usually familial aneurysms are at higher risk if you have more than one aneurysm, and naturally most at risk if you have any family history of somebody bleeding inside their brain. So if that's not the case, then you really don't need an MRI scan. However, if you're a hypochondriac and you want to be reassured, then maybe in many years when you reach 40, it wouldn't be unreasonable to get an MRI scan. Yes?
I had,
One more at the back.
one in the back.
Yeah, I just wanted to thank you for doing my surgery and allowing God to use you to save my life. God bless you.
Well, you know, I get thanked a lot, which is very, very don't save everybody. And it's always the ones that didn't do well and the ones that we couldn't help or the ones we hurt that really tug at your conscience. So no matter how hard we try, we're not 100% successful. So I appreciate your expressing that. But if you have thoughts and prayers, it's for those that don't do well and need help.
When I had my aneurysm, I was told that I said to the doctor, pray for me. And the doctor said, no, Dave, you pray for me. I bet you there's more people in here praying for you than the other way around.
Well, I can tell you that everything that helps, there's a lot of guidance. Yes.
Go ahead. She had a
Did we answer your
Well, I
question?
just was gonna ask, I had two births at the same time, Dr. took care of me, and then when he was gone, actually I saw you at the end of my table trying to decide what they were gonna do with the third one, but they were not able to tie it, they had to do another craniotomy. But since my blood vessels have 3 aneurysms, does that mean that my blood vessels are not as strong as normal people, or?
There are a third of patients have more than 1 aneurysm. So that's a pretty significant number. The largest number of aneurysms in one patient that I've treated were 12. So you're not anywhere near the record breaking. And it depends on the size of the aneurysms. Frequently they're in different locations, so they require different approaches. And you just have to deal with whatever.
But it's not the blood vessels are not necessarily worse than other people?
What happens is that blood vessels have junction as they separate like branches in a tree. And sometimes there's a weakness in that junction, and that lends itself to a higher risk of forming an aneurysm than in other people. There's a variability in the strength of those blood vessels.
You've talked about the aneurysms in the brain, and I've read that there's aneurysms in different parts of the body. Do you treat those similarly to the ones in the brain, or?
Yeah, you do. Wherever there are blood vessels, you can form aneurysms. In your liver, in your aorta, in your heart. Usually, the blood vessels that they form on outside of the brain are bigger blood vessels, so they're easier to treat. And if they bleed, unless it's from the aorta, which is that big blood vessel inside your chest, the risk is not very high. So if they bleed, for example, into the muscle or into the liver, it's contained and it'll stop the bleeding, and because it's not inside a skull, that pressure won't cause cessation of blood flow in the rest of the body.
So could you have one burst in another part of your body and not even be aware of it, or you would have symptoms?
You can if they're small, yes.
Well, my brother-in-law has one they identified a long time ago, and just every year he goes in and they're just watching it. And
yeah, if they're a certain size, we know from natural history studies that the risk of treatment is greater than the risk of leaving it alone, and that's probably the situation there.
Thank you.
I had acromegaly, and it was discovered about 40 or 50 years ago, and they gave me cobalt treatments that weren't really great. And then 5 years later, they sent me to Boston for proton beam therapy. And I was wondering if the radiation from that could cause the vessels in the same area to be weakened.
Radiation tends to actually make a blood vessel thicker. And one of the effects of radiation is really to make the blood vessels so thick that they don't allow blood through it. So that's one way of killing the tumor, the blood supply to the tumor, or even a nest of blood vessels like an arteriovenous malformation. However, radiation can also weaken the blood vessel, but much more likely is that it will thicken the blood vessel. It just depends on the dose of radiation.
Yes. Is an AVM an aneurysm, and then does it
AVMs are not as common as aneurysms, but AVMs are a tangle of blood vessels. They can have aneurysms within that tangle of blood vessels. They can be very large, they can be very small, but they're very different than the single or multiple aneurysm. That's really a different entity. But because there's so much blood flow going through an AVM, and blood flow is related to wear and tear on the blood vessels, you can form aneurysms just from that extra wear and tear on the blood vessels.
Hypochondriac back here. I was reading Natalie's website a couple weeks ago, and it says on there if you have Ehlers-Danlos syndrome, you have a higher risk. My husband has Ehlers-Danlos. Should I? Hypochondriac here.
There
Should I have a treatment?
There are, I think in the last count, 9 different Ehlers-Danlos syndromes, and it depends which kind he has.
Because it's very minor.
If it's very minor, there's no increased risk. It really has to be, I think it's number 6, but
I think he's like 2 or something.
Yeah. So I
okay. Or just shove him in there.
It's okay
anyway.
to be a hypochondriac for yourself, but if you're going to be a
I'm for
hypochondriac
everybody.
for everybody else.
That's huge. So now I'm a hypochondriac for everybody. Too much time in the hospital.
Yeah, as I said, you did my surgery at the end of October, and my left eye at that time was frozen shut, and my right side was paralyzed. And my eye is wide open, and I went to the eye doctor last week, and it says normal and healthy is this eye. And my right side is not frozen and paralyzed anymore. That's
true.
I just really thank you.
Aneurysms that are caused due to an AVM procedure, do they have any kind of history of rupturing more so than a genetic aneurysm?
The AVM itself has a higher risk of rupture at tangled blood vessels, which is a lot higher than the risk from the associated aneurysm. But if an aneurysm bleeds that's associated with an AVM, it's just like any other regular aneurysm with all the bad outcomes.
I just didn't know, because the AVM removal created the aneurysms.
No. The AVM removal doesn't create the aneurysm.
Well, that's what
the
I was.
AVM creates the aneurysm.
Well, I had an AVM that was removed, and then had a grand mal seizure that presented with 3 aneurysms. One which has been coiled, 2 which have not been treated.
Yeah.
And I didn't know whether those, because of the.
It's not from the, if your AVM was taken out, it actually reduces the risk of the aneurysm because an AVM is basically blood vessels coming from the heart with direct connections to blood vessels going back to the heart. So there's a big shunt. So you have a lot of blood flow going through there because there's no resistance. And it's that flow that helps form those aneurysms. So when you take that out, you're reducing that abnormal flow. So in some instance, the aneurysm will actually disappear. But that doesn't mean that the aneurysm will disappear. So you've probably had weaknesses there from the AVM, and also very rare cases of AVMs being associated independently with aneurysms. So it's one of those scenarios.
Okay. I mean, I was led to believe because the AVM was removed and this blood had to re-disperse, re-find its place, that.
No, not at all.
It put more pressure on the vascular
Not
system.
at all. Not at all. The pressure in your vascular system remains pretty much the same because the heart is such an incredibly powerful pump. You've got this whole network that's going all through the body. So an AVM in no way, with rare exceptions, ever affects the pressure in the rest of the brain.
Is that a hereditary?
Very, very rarely.
Okay.
Much
So
rarer than
if a family
aneurysms.
member had an AVM, it wouldn't necessarily be.
Right, not at all.
I have I don't know if it's a comment or question, but I know that I didn't find out about the aneurysm support group until my second aneurysm. I'm just wondering how we can get our group out more throughout the hospital to get other aneurysm survivors the help that I've gotten from everybody.
You know, there's absolutely no reason we can't have a card that can go to every aneurysm patient, and it can be up, it's obviously up to them whether they want to participate or not. But yeah, we can certainly do that.
Yeah, I've given brochures to the office, and then also we have them up in the family waiting room. So it's just a matter of the doctors talking about it, or your clinical assistants, or someone just letting people know that there is a group that's available for them.
I'll mention it to the residents.
Please do, because I have a couple of the girls that I have totally fallen in love with. I would have never met them had it not been for Natalie and the group.
Yeah, there's nothing like this in Canada. This is awesome.
One last real quick, easy one for you. I had my aneurysm back in '87, and you had mentioned about being seen every 3 years. I haven't been seen once. But my question is, isn't that.
Let me explain that.
Okay.
That's actually in '87. That's when we were under the impression that once an aneurysm is fixed, it's fixed. Then came out the studies that really occurred in the 90s that where we showed that if you have an aneurysm and you have it fixed, it's with clipping, it's very likely that will never recur. The risk of that over a 14-year period is less than 0.5%, but the risk of forming another aneurysm is much higher, and that's why we now recommend follow-up. So if you haven't had one since '87, you probably should have an MRA now. At some point, and then if they're the regular small aneurysms, usually every 5 years or every 10 years, another study.
Well, mine's at about 4 millimeters. Is that about?
Yeah, that's small, but that just shows you that small aneurysms bleed. But the smaller an aneurysm is, the less likely it is to bleed.
But my original question was going to be: is there cards that are given to survivors that have the information about the clip and the clip number and so on it? So if I go to have surgery someplace and they say, have you ever had a brain aneurysm? Do you have a clip? And I say, yes. Well, where's your card? I bet I've been asked 5 times, where's my card? I don't have a card. I do, however, have the clip number, but they keep asking about a card.
Yeah,
I didn't know if there was a card.
Well, that was more relevant in the old days because the clips were made from metal that were magnetic, so they had a risk when they went into the MRI scan. For the last 20 years, there hasn't been any clip that is not perfectly safe to be in an MRI scanner. So that sort of carrying a card that says you can have an MRI scan or not is just not
relevant.
Not relevant anymore.
Okay.
Nobody makes clips that are not compatible with MRI scanners.
Okay.
All right, last 2 questions. This is your 3rd question? All right.
When you did my head, you put a shunt in a couple weeks later. Can you explain what that is and if that ever has to be changed out or checked?
No, when you've had a bleed, like you obviously did, what happens is, like I showed you that picture of the brain with all the blood around it. When you have so much blood there, it affects the ability to absorb the spinal fluid, which is constantly being produced inside your brain. So many of you that have had bleeds will remember that you had a little tube coming out of your head, and that's to allow that fluid to drain because you're not absorbing it properly. And if you don't allow it to drain, then the pressure will get higher and higher and you'll have permanent brain damage. With time, frequently you can get by without a shunt because the blood will clear enough so it'll absorb the spinal fluid. However, if you have a very significant bleed, then you're going to end up needing a shunt because you can't absorb the spinal fluid. In an adult, once a shunt is in for for a bleed from an aneurysm, it's very uncommon that it requires revision, but it does happen. It's nothing more than plumbing. It can get infected and get it plugged up. But you would know when that happened, and I'm not going to tell you hypochondriac. The symptoms are.
I've already called your office 2 or 3 times, so I already know. I call quite often.
And you had one more question?
I do have metal, because mine was done in 1977. What is your choice to have it checked?
CT angiogram. Yeah, that's the best way to. And you should really avoid MRI scans.
Hi, my mother had an aneurysm, and her aunt had an aneurysm, and my girlfriend, her aunt also had an aneurysm when she was giving birth. Does that mean that my children have a higher chance of having an aneurysm? Should they get checked?
Your girlfriend had.
My girlfriend's aunt, when she was giving birth, had an aneurysm.
Yeah, and then his mother.
And then my mother.
You clearly have a high risk of aneurysms. First of all, you ought to be checked. How old were you when you had your aneurysm?
Oh, this is his mother.
Me, I was, I believe I was 55.
So probably around the age of 40. Okay. If you're a hypochondriac, then maybe 35. 40,
Let's do it now.
And then basically, depending on how good that looks, every 10 years.
What about my children?
Same thing.
So
same thing.
Around, they should be checked when they're in their 40s.
Yeah. If nobody, do you remember how old the aunt was when she bled?
Probably in her 60s. No.
No, she was
probably in her 30s.
There was 2 aunts that had it. My mother's sister had one, and I had one.
So who was the youngest when you bled?
That would be my girlfriend's aunt, who, well, she had birth, and I want to say probably in her, mid 20s to early 30s.
It would be interesting to know whether that really was from an aneurysm. There is an increased risk of bursting an aneurysm during pregnancy. We treat them just as if you weren't pregnant. They're clipped, and you can still have a normal vaginal delivery. But if she was really 30, then I'd probably start at 20. Sort of, I generally just subtract 10 years from the earliest rupture in the family history to be on the safe side. All right, last 2 questions.
In saying
Yes.
that, though, my cousin died at 19 of a brain aneurysm. So with my 2 children, and I had mine clipped. How would that work?
He was 18. Started age 10. An MRI scan, MRI is without any risk. Gives you a very good picture, and it can be repeated over and over again, as opposed to CT scan, which includes radiation. So in children, we really like to avoid CT scans. As we get to be adults, it doesn't make very much difference. But yeah, do that. Yes.
Yes. I know you were saying that if you smoke, it's really bad for people that have aneurysms. What about if you drink alcohol? Would that is that really bad for people that have had an aneurysm down the road?
What alcohol does is it decreases your resistance to having, for example, a seizure. When you have an aneurysm that's bled, you have injured the brain. So alcohol lowers the seizure threshold. If you've not had a seizure, and if you're not having any seizures, which is not very common with aneurysms anymore, especially with the newer techniques, there is certainly no harm in having a glass of wine. You're probably sort of asking for trouble if you do excessive drinking.
Okay. Thank you.
Sisters. Were you asking that about Robin?
Thank you. Hard for you. Dr. Spetzler, thank you.
Thank you.
So much.